I think the conclusions from the awareness survey is that there is actually a gap in the among the respondents with regards to their understanding on the disease and what is considered as a good health status. People still have this vivid image that complications are, very adverse, like amputations, strokes. But I think what is less evident is they don't know that diabetes is a major cause of blindness, the number one cause of end-stage renal failure, dialysis, and the number one also cause of heart attacks and deaths actually. The majority agree that diabetes is a serious condition, and also agree that the number of people with diabetes is rising rapidly in the country. I'm glad to hear that many disagree that there is not so much stigma associated with the diabetes. Only just about a quarter believe so. And also according to the respondents, about 60% plus, the biggest challenge is actually to living a healthy lifestyle is having a lack of time because of very long working hours, difficult travelling time, especially for those in the urban areas. A number of people looking at risk level among the patients themselves, that actually up to half of them, of the patients with diabetes, had a BMI above what is usually thought of as a cutoff point for Asians, which is about 23. So they are overweight. 3/4 actually believe that their weight is about right, or even a bit on the lower end, even though we do classify this as overweight. My diabetic patient came in today to clinic. His weight is actually ideal with a BMI of 22, and he's telling me that, am I not a bit too thin or too lean? We still think that you need to be a little overweight to look healthy, which is a misconception.
What's the most frustrating thing about treating diabetics?
Is when the patient themselves, they don't want to do it for themselves. Because now the concept of treating diabetes, they call it patient-centered care, where the patient is the center of the diabetes care team. And so the patient is central. So the patient is the one that should make the decisions. Doctors can't force patients to eat healthily. I can't force you to go exercise, but I want you to decide to do that. It's not just about dishing out medicines and telling people what to do, but actually telling them about the nature of the disease. So we look at diet care surveys done over the years 1998, 2003, 2009, and we just completed the 2013. The results are not out. So we're not really improving in the hospital setting in terms of getting more people under the target. The figure is about only 20% and a bit are controlled. So 1 in 5 reach the target, 4 out of 5 don't reach the glycemic target, which is quite dismal. In primary care, it's a little bit better. It's about 30% reaching target, and those you think are those with sort of milder disease, shorter duration of disease. By right, you should get more to target. I mean, you can compare this to possibly neighboring countries and Western countries. There are countries that quote as good as 40 to 50% of their patients are getting to target. Insulin therapy has advanced tremendously in Malaysia. The figure quoted is almost 20% of diabetic outpatients in primary care who are on insulin. And if you look at hospital care, that means patients attending diabetes clinic in hospitals, that's approaching about 60% on insulin. And this has changed a lot, meaning that doctors now are intensifying therapy from oral drugs to insulin. The only thing that hasn't parallel to that we don't see is more patients are being on insulin, but more patients are not doing better. the audits in the Ministry of Health looking at standards of care are showing continuously that treatment optimization is improving. Screening for complications like urine screening, eye screening, foot screening also is improving. Treating other related disease like hypertension and diabetes, cholesterol and diabetes is also really improving a lot. So it shows that within the Ministry of Health, both primary care and hospital care, we are improving in the way we're managing the disease. But whether the targets are achieved as we optimize, I think to some extent is determined by the patient themselves as well.
You don't say.